Good morning and welcome to the weekly COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We will start, as we always do, with the numbers. We've had a total of 11,171 confirmed cases, including 34 from Sunday and Monday. We've got 9 people in the hospital, including 4 who are in the intensive care unit. We have an available regional ICU capacity of 37.3%, and that is for, I believe it's 11 counties in the Northern California region, and that number is updated weekly. And we have had 179 people, Shasta County residents, who have died from COVID. With us today, we have Robin Schurig. She is the Director of the Public Health Branch of the Health and Human Services Agency. And Dr. Karen Ramstrom is our County Health Officer. Our healthcare partners with us today include Glenn Hayward from the Redding Rancheria, Dean Germano from Shasta Community Health Center, Robert Folden from Mercy Medical Center Redding, and Mark Mitchelson from Shasta Regional Medical Center. Thank you guys for being here. And Robin, did you want to start us off today?
Sure, yeah, good morning. The latest data for our tier assignment shows that our case rate has decreased from 10.0 to 5.9 daily cases per 100,000 population. And it was not adjusted up or down this week because our testing volume is about the same as the state's. Our test positivity also decreased from 3.9% to 2.5%, and our equity metric decreased as well, from 2.7% to 2.2%. So we are now firmly in the red tier. In order to move to the orange tier, our case rate would have to decrease to less than 4 daily cases per 100,000 population, and we would have to meet that qualification for 2 weeks, in a row before we would actually move to the orange. So again, it's a matter of whether our case rate continues to decrease versus when these more infectious variants arrive and push our case rates back up. And again, the things that we can do to keep our case rates low are to continue masking and distancing, get tested, and get vaccinated when it's your turn. That's all I have this morning. I'll turn it over to Dr. Ramstrom.
Good morning, everybody. So just a quick update on vaccine. I think everyone is aware that we received our first Johnson & Johnson, the Janssen vaccine allocation last week. It did arrive, and so we are working with our vaccine provider partners to determine the best use of that vaccine, single-dose vaccine, highly effective in preventing hospitalizations and deaths, with a good safety profile similar to the Moderna and the Pfizer. How we want to use that vaccine until we have really good supplies of that single-dose option. And so that's in the works right now. We're really very excited about that opportunity to vaccinate people who might have a hard time getting to a 2-dose series. Our vaccine allocation numbers are going up, continuing to go up every week. And with the addition of the Johnson & Johnson as a 1,400 dose allocation, they jumped our allocation numbers last week. So that's good. We won't receive an additional allocation of Johnson & Johnson until the week of March 23rd. And that's all I have this morning, but happy to address questions.
Okay, did any of our healthcare partners have anything they'd like to share this morning? Seeing no green lights, we will open to media questions.
Well, we jumped right into this. Oh, go ahead. Go ahead, Jessica.
Oh, that's all right. You can go first.
Okay, I'll be quick, I promise. I just wanted to ask, are we, either for Dr. Ramstrom or Robin, are we at a point where you're concerned about people being overconfident now? You know, the numbers are going down, people are getting vaccinated. Do we need to worry about people, you know, kind of backing off on the things that we should still be doing?
Yeah, I would say that combined with these infectious strains making their way here eventually are our 2 biggest concerns. So yeah, as more things open up and as we start to hear about more people getting vaccinated or people themselves having been vaccinated, feeling like they're protected and going out and doing things that they wouldn't necessarily have done previously, I think those are the 2 things that are going to potentially increase our case rate if we can't keep up with getting more people vaccinated. don't know if you had anything you want to add to that, Dr. Ramstrom.
No, nothing.
Thank you.
All right,
just-
Jess.
Oh, sorry. This question is for Glenn Hayward. We were trying to figure out exactly how fast your schedule filled up yesterday after the announcement that you had a new clinic opening at the Reading Rancheria. Could you give us a ballpark idea? How fast did you fill that schedule?
Sure. We got about 170 phone calls in the first hour, which crashed our phone system for about 5 or 6 minutes. But after that, 800 people got registered in about 3.5, 4 hours.
Thank you.
Good morning, everybody. This is Anna here from Channel 12. I just wanted to go back a bit on the J&J vaccine. I know, Dr. Ramstrom, you mentioned the county received its allocations. Have those, have those vaccines been, will they be used basically for upcoming vaccine clinics, or are you guys still figuring out how you're going to distribute them?
Yeah, thanks, Anna. It's we've made some decisions, but it's still a little bit in the works. We'll continue to talk with our vaccine providers about their particular needs. The kinds of situations where we will be using that vaccine until we have better supply are situations where a person might have challenges getting a second dose. So our strike teams could use them when we're trying to reach homebound individuals. People who might be have the inability to find transportation or aren't transportable, maybe in group homes or other kinds of residential facilities. We've talked about using it for mobile kinds of clinics, if that, once we're able to do that. And we've been talking with Shasta Community Health Center in that regard. It's easier in terms of handling. It requires just refrigeration, is more stable. And so that makes it easier for us to go out to the community. And so we're really happy to have that partnership coming about with Shasta Community Health Center. So those are the kinds of situations. If we had workers who were mobile and going to different settings, that kind of a thing, wherever we might have situations where it might be hard to find a person for them to access a second dose.
So at this time, they haven't been distributed just yet.
Not quite yet.
Perfect. And then just to follow up on that, how many doses of that vaccine have we received?
So we did receive our full allocation of 1,400 doses just today, I believe.
Perfect. And I also just wanted to follow up and ask, these vaccines won't be used for any upcoming like mass vaccination clinics that are planned for this week or this weekend.
So again, it'll be used for those limited situations I mentioned. So they probably will be smaller types of events, more targeted types of uses.
Glenn, you got an allocation directly as well, did you not? And what are your plans?
We did. We got 400 doses, and we're doing the same as public health. We're trying to figure out how we can utilize those best. We do have a lot of Native Americans in rural areas, especially in Trinity County out in Burnt Ranch, that can't get in to get the vaccine. So we're looking at mobile units. Also, we're looking at possibly, we've worked with Alex Gee with public health, and she has a list of food service workers and agricultural workers that it might be beneficial to start vaccinating some of them. So we're just trying to figure out how to use these doses as best as possible.
So the Johnson & Johnson was not allocated for the Sunday clinic. It is being pulled aside specifically for those people who are homebound, et cetera.
Well, we don't know what we're going to use the Johnson & Johnson for yet specifically, but no, we'd had the Sunday clinic already planned, and there's a lot of logistics that go into planning that. So we had those before we even received our doses of the Johnson & Johnson. We'll just be using Moderna for the Sunday clinic.
Got it. Thank you.
Sorry, Anna here. I just also wanted to ask on something too. I came across an article and I found it on CDPH guidelines that it sounds like, visitation restrictions in nursing homes are slowly starting to lift. What is that looking like for our nursing homes here and skilled nursing facilities here in Shasta County?
Right, so that all facility letter went out, as you said earlier this week. And so basically it's incorporating the fact that our skilled nursing facility residents and staff have had the opportunity to get vaccinated, as well as other long-term care facilities, as we talked about, because those residents and staff have higher vaccination rates now. They send out this AFL to change the visitation with regard to whether visitors and also the residents are vaccinated. And so basically it allows visitors who are vaccinated and those residents to receive visitors in a more flexible manner than it did previously, whether it's in their room or it's indoors. Previously, visitation was recommended outdoors. It allows some brief physical contact, hugging and helping with feeding, that kind of a thing, while continuing to maintain mask use and physical distancing as much as possible. But it is more flexible, which is nice for our skilled nursing facility residents to be able to see their family. But again, there are specific requirements around vaccination status of the residents and the visitors.
So is for skilled nursing facilities and those kind of shared living spaces, does that mean, or does this depend on the home itself that they can allow visitors right now based on those guidelines?
Yeah, it applies to all the skilled nursing facilities. They all receive the same all facility letter from the state.
Dr. Ramstrom, while you're right there, the CDC put out some guidelines recently, about people who have been vaccinated now and what they can do and what they still shouldn't do. What does that look like locally? What are you recommending for people?
Yeah, CDC has updated their guidance in terms of vaccination and recommendations for mask use and physical distancing for vaccinated individuals. That hasn't been implemented in the state yet. We wait for guidance from the state health department based on our own situation in the state in terms of transmission, consideration of the variants and that kind of thing. So we're hoping to learn more later today from the state. We have a standing call with them. So we'll see if they have any updates for us on that. The CDC guidance basically allows vaccinated individuals to get together with other vaccinated individuals or low-risk unvaccinated individuals in very small groups without mask use. And so we stay tuned. We'll see what happens when the state interprets that for California based on our own situation here.
Thank you.
Other media questions?
Sorry, I just have one more. This one's kind of all for our health leaders and our health partners out there. I mean, tomorrow, March 11th, kind of was the day the shutdown started happening across our state, across the country. Last or earlier this week, we marked our first, 1 year ago would have been our first COVID case. So since then, 1 year later, how has everyone been feeling with everything that has been going on?
I have pronounced bags under my eyes. So, I was fortunate. I got to participate in the interview. I'm proud. I stand by that comment. I'm really proud of our staff. I'm proud of our docs. I'm proud of this group. I think Dr. Ramstrom has done yeoman's work to pull many different people together to help manage through this.
I agree with Robert, and I think that you have to look at the collaboration of all these hospitals and the health systems here all working together with the same vision, and that is to vaccinate people, keep them healthy, and keep them from getting sick. And we've had some exceptional leadership from Dr. Ramstrom and the Public Health Department, and all these entities are working together with the same goal. And I think that's just a great thing for this community. It's the only way we're going to get through the pandemic is working together.
I would just add that what the public doesn't see is the amount of work that went behind the scenes to make sure that we had an effective response. And I agree. I think public health, in particular HHS, and all the partners, I think we knew what was at stake here. And financially, I think we've all been taking a hit on it, but it's not what drives us. It drives the community's health is what drives us. And this was a great statement of we can pull together and do what's necessary. And so right now, I'm just living in the moment, just doing what's necessary for the next step, and hope we can get to some level of normalcy by this year at some point, I hope.
And I would just add, I think this has helped the county as a whole and us as healthcare partners, creating a template for what is a good, effective strategy for addressing these issues. So although, you hope that this never happens again in our lifetime, there's always that chance. But I think that this has really given us a good template for, what if another thing happens.
Other media questions?
Sorry, Anna here. One more thing before, we let you guys go. This one's for Robin. Robin, you were talking about the red tier right now and how our numbers have been on the decline. What does it look like right now, at least? Are we on track to heading back into the orange tier where we were last year?
Yeah, it's possible if our case rate continues to decrease. As I mentioned, it's at 5.9 right now, and it would need to be below 4 to qualify us for the orange tier. So if that happens sooner, then we see potentially an increase because of these more infectious variants coming. Then we could move to the orange within the next, several weeks or so. We'll just have to wait and see what happens. And like I said, continue to mask and distance and get tested and get vaccinated.
Is just to follow up on that, is like vaccinations also helping out in getting our numbers down?
So vaccinations aren't directly correlated to our tier assignment, but the more people who get vaccinated, the less cases we're going to have in our community. So in that way, yes, vaccination definitely is helping our case rate decrease.
Anything else, Anna?
I think I'm set. Thank you so much, everyone.
We have a question from Donnie Chamberlain that says, are restrictions being relaxed regarding which groups and ages receive the vaccines? For example, there's a Safeway Albertsons online application for vaccine appointments, and there were no restrictions with regard to age or occupation or risk. With this system, anyone can apply for appointments at the Shasta College Clinic. Is public health okay with that? Does it allow people to cut in line for a vaccine before their appropriate time? And I would love to answer that. When you go to that Safeway page, that very first link that you get, it says, please answer following questions to confirm you're eligible for vaccination. And it does list the eligible vaccine groups, including people over 65, emergency services, food and agriculture workers, teachers, school staff. It defines teachers, and it says, please bring proof of eligibility to the appointment. And then there's a box that you click, and it says, by clicking this box, I attest that I belong to a subgroup of the population that is currently being prioritized by the local and state Department of Public Health for COVID-19 vaccination. Now, somebody could click that box who does not belong to those groups, but it appears that Safeway is in fact asking people to bring proof of eligibility. So we would not recommend that people jump out of line and take a spot that is designed for somebody in a higher risk age group. So I think that answers all of those questions. If I missed anything, let me know. And if we don't have any, do we have any additional media questions? I do have a couple questions from the public. We do have a little bit of time to ask. Okay, here we go. as you know, we've had a couple of town hall meetings where people asked questions live. We're not doing that this week, but we do frequently and all day answer questions that come into our Facebook Messenger or into our COVID-19 inbox. So we do answer questions from the public and welcome questions from the public. And we'll also be asking those in this forum as we have time moving forward. So the first question is, what is the purpose of HHSA asking for mother's first and maiden name at top right? And that's of the sheet that you fill out when you're getting vaccinated. Is this for tracing of some kind? Are you looking at if injection recipient is living alone and might experience a serious adverse reaction or death? Not seeing any emergency contact info on any forms I have come across, not asked at all on the SRMC document. Please clarify the lack of uniformity on these pre-screening forms. Karen, did you want to address that?
Sure. Yeah, I just wanted to say that some of the much of the information, so that form is used to gather information to assess appropriateness of vaccination for that person, that they are getting the right type of vaccine and it's safe for them to do so. Asking about the mother's maiden name has to do with data entry into the CARE vaccine registry for California. And we use mother's maiden name to help if we actually are trying to make sure that we have the right person, if there's similar name and age, date of birth of another individual. And so that's how that information is used.
All right, thank you. What are your safety protocols if a single person goes home without a follow-up, has no smartphone with the VSafe app? And will forms better reflect careful tracking of single people who may be in very serious demise?
So I think that we've talked before, and others can weigh in, that, you know, we ask about history of allergic reactions to other types of medications. And based on a person's individual history, we ask them to wait either 15 or 30 minutes after getting vaccinated. That's the time period where the immediate, more serious adverse reactions can occur. Rarely they occur, but they can occur, and that's when we would expect it. And then once they've met that time period, they're free to go, and they wouldn't be expected to have those kinds of reactions after that period of time. Certainly, if they did, we would want them to call their doctor or call 911 and to seek medical care.
All right, thank you. How are these mRNA shots impacting all the other shots people take, like shingle shot, pneumonia, seasonal flu shot, travel shots? And where are the studies about interactions? How are you studying this complexity while you promote as safety and efficacy? How define any differences with 2-dose and 1-dose by Johnson & Johnson? Information about all three of the vaccines are available on the CDC and FDA websites. We are not in charge of those documents, but anybody is welcome to look at any of those documents online. And then about the vaccine interactions, Dr. Ramstrom, do you have a response to that?
Sure. The CDC clinical guidance indicates that not to administer the COVID-19 vaccine within 2 weeks of another vaccine, just because we don't have enough experience with how this vaccine might interact, and we want to make sure it's effective and maximize efficacy of the vaccine. And not interfere with the immune response to other vaccines. Until we have more information on that, there's that 2-week period that is recommended between the COVID-19 vaccine and any other vaccine.
All right, and I have two more, one for you, Dr. Ramstrom, and one for me. The first one is, what protocol, if any, is advocated for those volunteering for these experimental injections by Pfizer, Moderna, at Vax clinics? Is given by the local HHSA or public health to mitigate side effects and reactions? Did you understand that question? Also, if the doctor is available today, where is the immune system if agents go into deltoid and break down locally? Seems Dr. Ramstrom made it sound like the mRNA does not travel through entire body. Clarification needed.
I'm not sure if I understand the first question. I mean, we've talked about how we have these screening forms to ask about any particular contraindications to vaccination, which we routinely do before administering any medication. And so those are the safety kinds of protocols that are in place. I think that might answer the first question. In terms of the way the mRNA vaccine works, when it's administered, it actually starts the immune system in that area to respond to that little bit of mRNA that looks like the spike protein. So that next time that the body encounters that, it's ready and primed to have a faster immune response and fight off the infection. So it just starts locally, and then the immune response happens even if you, you know, had a cut on your finger or something. You know, it's just, it starts locally and then it spreads as appropriate as the immune system normally responds, depending on what the antigen is.
Thank you. And then the last question, when will next live in chambers option return again, as we have massive questions to ask in person and not have read from an email format? And what happened to the YouTube segment of our live chamber questions from last week, March 3rd? I believe YouTube was done twice before, and I would be happy to take that one. The public is welcome to email covid19@co.shasta.ca.us with their questions, and our public information officers will continue to answer them. I am one of those people, and when I don't know the answer to a question, I certainly reach out to our health experts, including Dr. Ramstrom, to answer those questions. So you are getting answers from the people who know these things. And we have had that option available since the pandemic began. So we're not going to stop that anytime soon. And as you can see, as time allows, we will also include public questions at the end of our Wednesday media briefings. One of the advantages also to submitting questions ahead of time is we noticed last week that there were people that wanted data that we did not have at our fingertips. So if we receive those questions ahead of time, we can do that research and provide you with the answers to those questions right away during our briefings. And then the Facebook Live video from the town hall meetings is still on our Facebook page. Did any other media questions come up while we were going through those public questions?
Hi, Carrie. Sorry, Anna. I just wanted to follow up on something. I just realized last week at last week's media briefing, it was mentioned that the Johnson & Johnson vaccines would be arriving sometime this week, but they actually, I guess from the Rancheria and Public Health, they were received earlier, late last week. Was it just the shipment came in faster or anything like that?
We received ours this week.
Okay, never mind. And then I think that one, the Rancheria one, was for Glenn, because it was mentioned like last week that you guys were supposed to receive your Johnson & Johnson early this week, but then you guys also received it late last week, correct? I just wanted some clarification.
Correct. Yeah, we get an email notification from Indian Health Services of an estimated delivery, and then we get another email that says it's on its way. It arrived late Friday evening.
Okay, thank you for that clarification.
Any other questions? All right, hearing none. Thank you everyone for being here with us today. We will be back next Wednesday at 11 a.m. Everyone stay safe and healthy.